to talk about somebody who came to our clinic from another country with ALS. So he first, and along with the ALS came a lot of brain fog and what he thought was cognitive decline. He was a man in his 60s, and he came and he had Lyme disease. Now, his Lyme was treated by Lyme literate doctor in his country. And then he came to us thinking he still has Lyme and wanting treatment for ALS, of course. Now, I did the T-cell test to see if he does indeed have Lyme. And boy, was his body acting like he had Lyme, right? He had all the telltale signs, the brain fog, the neurological issues, the whole thing, the pain. So we thought, well, maybe the Lyme and the other tick-borne diseases have not been treated yet. Well, let's test that. Oh my goodness, they have been treated. There is no Lyme active here in this man. Okay, so what else? What else is going on that's causing inflammation? So this was prior to the availability of the cytokine panel that I love that Dr. Bruce Patterson developed. So we didn't test inflammatory cytokines yet. But I did test toxins. Mercury was through the roof. So he had mercury that was high, unprovoked, as well as a high body burden, which I saw that was provoked. And not only that, but he worked and he lived in an area where there was a lot of environmental toxins, and right near a golf course. Glyphosate was higher than I've ever seen in anybody, hands down. So the good thing is we didn't kill infections because we didn't need to kill those infections. And so I did a lot of detoxification for him. So heavy metal chelation, as I chelated him, I saw that the fasciculations in his body started to decrease. By the way, he came to us in a wheelchair. Okay, we gave him a lot of phosphatidylcholine IVs to help with the nerves and to help with detoxification. And so he was doing these IV treatments 2 times a day, 4 days a week for, I can't remember if it was 2 or 3 months, but 2 or 3 months. I think it was 3 months actually. And then we gave him exosomes. By the end of it, he was able to get up out of a chair on his own.
Wow.
He was able to walk down the hall and through the parking lot where before he couldn't take a step on his own at all, wheelchair bound. His arms were locked in like this. He was suddenly gesticulating. He used to talk really, really slow. He couldn't swallow liquids. Well, that was gone. And then his mental functioning was starting to come back. Now there's a piece that's not treated. And by the way, he's not better. He needs more treatment. You know, he still has to be in a wheelchair a lot. But he's so much better in just 3 months of treatment. I mean, so much better. And so he has a bunch of cavitations. And so he needs dental work, which he's going to be getting soon. And I have a feeling that's going to lift the cognitive stuff even more than the other therapies already did. So, you know, here's somebody who just with 3 months of treatment, significant changes, and still has a ways to go, but it was just so rewarding